Hi, I'm Eva Nadia Binti Sahari, and I will help you guys to understand about goal attainment skill. Introduction. GUESS is a method of scoring the extent to which patients' individual goals are achieved in the course of intervention. In effect, each patient has their own outcome measure, but this is scored in a standardized way as to allow statistical analysis. The developer is Dr. Jake Singh and Mr. Robert E. Sherman at Hennepin County Institute of Mental Health USA on 1968. The purpose: first, to calculate the extent to which a patient's goals are met. Second, to develop personal goals for a client during the development of their intervention. Third, allow patients to set individual treatment goals together with their treating professional. The type is clinician-rated assessment. GUESS involve communication and collaboration between therapists with the patient as they meet together for goal setting. Moreover, goals are more likely to be achieved if patients are involved in their setting and encourage patients to reach their own goal. Component being assessed: first, body function; second, activity and participation; third, environmental factor. Target population of GUESS: mental health, cerebral palsy, brain injury, vestibular disorder, and pediatric disorder. Contraindication of GUESS: poor insight and mental retardation. Based on a few research, stated administration time of GUESS is 5 until 16 minutes. Next is administration procedure. Normally, three goals are identified, which are incorporated into a single GUESS score. The three objectives that are agreed as the most important to the patient. Next, weight the goal. Weight is equal to importance of the goal times by difficulty to do the goal. Then therapists define the expected outcome. Expected outcome is the most probably result if the patient receives expected treatment. This is usually rated by -1, unless the patient is as bad as they could be in that particular goal area, in which case the baseline rate is -2. Using this baseline score as a substitute for attainment level in the equation, a baseline goal score can be calculated. Please feel the expected level goal is at +2 much more than expected, +1 somewhat more than expected, 0 patient achieved the expected, -1 somewhat less than expected, -2 is much less than expected. These are defined by the therapist and should be as objective and observable as possible. This process also provides an opportunity to negotiate with the patient if they have unrealistic expectations. For example, if the patient wants to take medication by own without any help and realistically he takes the medication without any remind from his partner, also without any alarm to remind him, the task can be set at +2. This way, the patient aims are not dismissed but are clearly defined as beyond the level of expectation. Goal attainment score calculated by applying a formula where Wi the weight assigned to the any goal, xi the numerical value achieved between -2 and +2, p the expected correlation of the goal scale. For practical purpose, according to Singh and Sherman, p most commonly approximate to 0.3, so the equation simplified to all the goals met the expected level of achievement, GUESS T-score is 15, and there are a few interpretations that meet based on range for the GUESS T-score. Psychometric properties of GUESS. Were to excellent internal consistency at 6-month follow-up R equal to 0.32 until 0.84. Second, this is based on 5 context area reflected. Gas have excellent iterator reliability, which ICC value is 0.86. The gas has demonstrated generally high content validity. Our data evaluate 329 gas scale and follow follow-up interviewers deemed 93% of the scale as relevant to the client and 70% of the scale were judged as accurate. Convergent validity of the gas was confirmed by moderate to high correlation with the health stiffness rating scale, which R equal to 0.7, P is less than 0.01. Advantages of gas. Encourage patients to reach their goal by involvement in setting the goal with therapists. Second, the tasks are individually identified to suit the patient and levels are individually set around their current and expected level of performance. 3. Good measure of outcome as it's sensitive to change because it is based on criterion reference rather than norm reference. 4. Provide clear measure of goal achieved. Gas are not being translated in Malay version. Gas are not being a fixed tool. It lacks the psychometric properties usually expected of assessment and measurement tool. Third, took a long time period to complete. Fourth, required course training for administration. Gas can be used in Malaysian population as it is client-centered approach, which measure progress of client goal and can be written at all level of functional difficulty. Assalamualaikum Puan Nurul.
Salam.
Saya Cik Izzah Nadia. Saya sebagai terapis anda hari ni. Okey, saya nak tanya beberapa soalan kat Puan Nurul. Okey, soalan pertama saya, sebenarnya apa goal yang Puan Nurul nak sangat atau inginkan untuk diri Puan Nurul?
Saya nak makan ubat tanpa pertolongan daripada ahli keluarga ataupun partner saya.
Baiklah Puan Nurul, bagi Puan Nurul, kepentingan untuk melakukan goal ni, saya bagi skala 0 hingga 3. Berapa kepentingan dia? Kalau 0, tidak penting. 1, sedikit penting. 2, penting. 3, sangat penting.
Sangat penting.
Sangat penting. Okey, bagi kesusahan pula, skalanya masih sama, 0 hingga 3. 0 tidak susah. 1 sedikit susah, 2 susah dan 3 sangat susah untuk Puan Nurul buat goal ni.
Sangat susah.
Sangat susah.